your screen. So with that, if Dr. Anto-Ocrah or Dr. Huang would like to unmute and share, we currently have the screen set up here in person so that you'll see the slides. I can advance them, and you are on the top right in speaking corner break. So Dr. Anto-Ocrah, we have you on screen. If you'd like to take it away, and we'll adjust the volume.
Absolutely. Absolutely. Forgive me as I move through my home. I have a child who's homesick, so I'm glad that you're letting me go first. You're letting our team go first, so I can take care of some family needs. But thank you all. Can you guys hear me okay? And see me okay? Okay, perfect. Yep. So Dr. Gifty Merdiemah, who is the brainchild of this project, is not able to join. I think she's not on the call currently, but she's based in Ghana. And this project is actually Dr. Gifty's brainchild. We are just the conduits to sort of helping make this dream come true. We are very fortunate to have this project funded by Google. We just got an email today that all the funding has now come through. And this is a perfect example of like just people meeting, good energy people getting together, having discussions, and where friendship then evolves to become a project. And to say that when I first met Tim and Ravi, to think that fast forward now would have a Google funded project, I don't think I ever envisioned that. But it's really amazing. Our wishes came true. So in a nutshell, I'll just give a very brief overview that I have put together. But really, this part is really about how, as we know, AI has the potential to address significant health disparities globally. But its implementation must be approached in a way where we avoid perpetuating existing inequities. So for example, I'm from Ghana, West Africa. When I travel to Ghana, my biggest need actually is usually, it's not the cell phone, it's the data. My data goes so fast. I spend the most money on data and transportation. So Google has an AI for social good agenda, which really hopes to emphasize inclusivity, transparency, and global collaboration. And if we're able to use AI, it really can be a powerful tool for improving health outcomes and reducing health disparities. If we're not able to use AI appropriately, it can really deepen existing divides and create new barriers to healthcare access. If I have limitations in accessing data when I'm in Ghana, I will have limitations in perhaps using like digital health, right? Or telemedicine. That becomes a problem as we see how fast and how quickly AI is moving. So really the goal of this project is to have global collaborations. We have the University of Pittsburgh, we have KNUST, with Dr. Merdiemah is at. We have the University of Ghana Medical Center, and we're also involving some agencies in Ghana, including the Ghana Health Service, in order to get their buy-in, because this project is really about sexual health and sexual and reproductive health, and that in some ways is quite taboo. So I will then hand it off to Dr. Tim to talk a little bit about what we're thinking about the tech part and the innovation part.
Yeah, thanks for the great introduction of the goal of this project. And in terms of the technology part, right, just like Dr. Martina just said, initially we are thinking about to promote the use of the AI in this population, but it seems like they are going to experience multiple layers of the barriers. Initially, the first step is that they don't have access to maybe internet, they don't have access to the platforms, or they don't have right device to access the design we are going to come up with for them. And that's the main problem. And even they have access to the internet, to even have the access to the data, they might not be motivated to use that. That's another layer of problem. So how we are going to motivate them by design that's a major issue. And even they have motivation to use that and have a material or physical access to use that. Another layer of problem is that they might not have the skills to use that as the way we want them to use the design or device we designed. So that's another issue. And last but not least, they also have some potentially usage issue. So even we design for them, and even they have the skill set, they might not have the habits, or they might not use the design as a way we want them we want them to use. So based on these multiple layers, the one of the best approach to address this issue is to design with the users, which we said user-centered design or patient-centered. In this case, there could be community-based center design. So we want their input to tell us what's the best design for them. And when we talk about the barriers, we always think about the deficit-based model. It seems like they're lack of something, so we want to teach them, or we want them to know something before they are going to use the design we have. But in this case, we are thinking about that thinking about the design in a kind of different way. So we are trying to identify what they have in their community. So instead of using a deficit-based model, we aim to use the asset-based model and we will design based on their community resources in the community, and also based on their strength of the community. Then and in this way, they are more likely to use the design we are going to come up with. Yeah. So that's the technology part, and all of us have different, like already start kind of initial research on different product. Yeah, so like for myself, I have some research on digital divide and different layers topic in terms of different level of barriers. And we also, Ravi and I also have some publication on this topic in terms of patient-centered design and patients' willingness to use the new technologies or to use like electronic medical records. And so I think that our next step is to try to understand the needs of users so we can identify barriers for them and design with the populations. Yeah. Anything I missed, Martina? Cool. All right, so that's a brief introduction of the tech part and how we are going to use the tech to address the issue in the community. So questions?